Hi everyone. Today we're gonna go over an exercise. We just call it hip abduction exercises. And a common thing we see in our patients with dizziness and imbalance is difficulty with rotational movements, which are integral to daily life. Walking, running, reaching for things, and so on. All sports involve rotational movement. And so oftentimes people struggle with that, partly because they have difficulty recruiting the muscles on the outside of their hip and towards the back. These are called the external rotators of the hip and the abductors. And so to give you a little example or a little kind of anecdote, I'm just going to come into the shot here. So when we're standing, and if we want to kind of stand on one leg, what ends up happening is gravity wants to kind of, which we lost some support now, gravity wants to take us back down that way. And so to pry our bodies up, these muscles gotta pry us up and keep us up. And if you want to kind of experiment with that, you can stand with a friend kind of right next to you or next to a wall and try to lift this leg without leaning into the wall or leaning into your friend. See, people tend to kind of sway this way so they can kind of help themselves along. But what we're trying to do here now is get you to start recruiting these muscles so we can increase our somatosensory sense to help our balance and improve our dizziness. So for example, I don't have someone next to me, but if I did, I'd try not to lean into them and touch them, and I would really have to fire this really hard and recruit my abdominal muscles to kind of go right up. Try it out. It's tougher than it looks on camera. And so what we're going to do here now, we're not the biggest fans of isolation type exercises, but sometimes people need to feel it to heal it. And so what we're going to do here now is we're going to get the patient really straight, their spine is straight. There can't be a kink here in the hip. If their hip comes a bit forward, then they are going to start using the wrong muscles. We want these muscles over here. And we're going to get him to kind of raise his leg in a second. And what you should be able to feel is these muscles on the side here kind of expanding and getting a bit stronger. So before he does that, he has to do the same thing we always kind of show you, is he has to kind of brace his abdomen, expand his transverse abdominis so that his core is quite activated. And now, Mo, no, go ahead and do it. And what you'll find is a lot of people, they kind of roll backwards because they're trying to help the movement along. And so, someone will be there to help roll him so that he's really using those muscles. And there he is. I can feel it now. Back, and I wouldn't go all the way down, just keep that muscle always kind of tense. And then once that is easy for you as you progress, then you start going forward and backward, just an inch. Very little, Mo. Yeah, very little. It's about control. It's actually harder the less you go. And then and then you go circle, little circles, and then little circles the other way. And keep this recruited. And then figure of eight. Figure of eight one way, figure of eight. And you can see now he's starting to shake. It's getting tough. And that's how you do that exercise that we call hip abduction exercises. Eventually, once they can learn to turn it on, then we're going to integrate that in all sorts of movements that involve rotation while standing. And that will translate to better balance and a more sense of feeling grounded, less dizziness.